Now football season getting underway in earnest and possibly means more concussions, plus keeping the players hydrated during the hot days of practice and game nights as well. With advice on both, Dr. Ed San Miguel, an emergency room physician at New Hanover Regional, with us today. Ed, good morning. Thanks for coming in.
Good morning. Thanks for having me.
For those not sure what a concussion is, briefly tell me what you mean when you say the word concussion.
Concussion means an injury usually affecting your head, and more important symptoms are not remembering what happened or confusion. Unfortunately, the vast majority of concussions that we see, particularly in sports, are unrecognized, and the reason being because there is no loss of consciousness involved in the event. The player simply is stroking the head or takes a fall, and then you get back in the game. But times have changed, and we're paying a lot more closer attention to what a concussion is, how it should be managed, and what we should expect in the future.
I think the old line was he got his bell rung out there on the football field, but it could be a lot more serious than just that.
Certainly could be, and parents need to be, and the coaches and the other players, and they look out for the symptoms, the confusion, dizziness, having a headache. Very difficult to tell how long the symptoms will last and what the outcome is going to be long term. A lot of it has to do with the intensity of the injury. But prevention is important, wearing helmets, wearing the proper equipment so you're safe out in the field, knowing that when you get a concussion, it will be important for a primary care provider or their physician or a sports medicine specialist to clear you to go back to the field so you can safely participate. One of the most dangerous events is when somebody gets a concussion before you recover from the one you just had the week before, and you get another one. Consequences can be long term in that case.
So just don't get caught up in the moment, and let the player continue on. Maybe bring them off for a play or two. Let him be evaluated at that point on the sidelines.
That's very important.
And we're not going to talk about football, but you know, we've seen these in basketball when people go up for rebounds. And just outside playing, just absolutely the kids falling off a bicycle or something where they should have a helmet on, but if they fall and take a little blow to the head, they need to be checked out for that.
They should be. They should be. They should keep an eye on them, and it is important that they call their providers and ask questions and follow the instructions.
Make sure they stay hydrated. A lot of people, again, you know, talking about only during the practice. They got plenty of water out there for the players and, you know, things like that, and even just kids playing outside. But they need to stay hydrated, even though it might not feel that bad outside today. Even days like today playing, you can work up a sweat and get dehydrated.
Yeah, absolutely. I think one easy rule of thumb will be you play 30 minutes, you should take a break in an area where you are in the shade and you're cool, and make sure. An important issue that we probably forget is to avoid taking any drinks that have caffeine involving power drinks or anything like that, because that's also an alcohol, of course, because those are diuretics, so make you lose even more fluids, and certainly places you are at risk for injuries.
It comes down to basic common sense, doesn't it?
Absolutely, yeah. Common sense, have fun, take advantage of the sports, get the kids out to be active and playing, but play it safe.
Absolutely. Yeah, thanks very much for joining us.
My pleasure.
I appreciate it. Thanks for coming in this morning.
Take care.
All right, we're going to tell you about another story.